Hello everybody, we have talked about antibiotics absorption and distribution in previous videos. This video will be talking about step 3 of pharmacokinetics, which is known as metabolism. Most drugs are chemical substances that are not naturally produced by the body. The chemical reaction occurs that can convert these drugs in compounds easier for the body to eliminate. This process is called metabolism. Lipophilic drugs are involved in hepatic metabolism and the metabolites are eliminated via the kidney, while hydrophilic drugs involve minimal hepatic metabolism and are usually eliminated in unchanged form. The resulting byproducts of metabolism are called metabolites. They can be active, inactive or toxic. Clarithromycin, erythromycin, metronidazole, and clindamycin are metabolized into active metabolites and have therapeutic effects even after metabolism. Penicillin, ampicillin, and cephalosporins are metabolized into inactive forms and do not contribute to antibacterial action. Some antibiotics are metabolized into toxic forms, causing serious side effects. Metronidazole metabolites can cause neurotoxic effects. Chloramphenicol metabolites can lead to bone marrow suppression, while tetracycline metabolites can cause liver toxicity. First-pass metabolism, also known as first-pass effect, is a phenomenon in drug metabolism whereby the drug concentration is significantly reduced before it reaches the systemic circulation. This process occurs primarily in the liver and the intestine. When taken orally, a drug is absorbed through the gastrointestinal tract and transported via the portal vein to the liver. The liver metabolizes the drug extensively, often resulting in a substantial reduction of the active drug that enters the bloodstream. This can affect the drug's bioavailability and efficacy. There are two main phases involved in metabolism. Phase 1 metabolism yields a polar water-soluble metabolite that is often still active. Many products from this phase can become substrates for phase 2. The most common chemical reaction in phase 1 is oxidation, primarily catalyzed by cytochrome P450 enzyme. These enzymes oxidize antibiotics, forming more hydrophilic metabolites that are easier to excrete. Drugs that interact with cytochrome P450 can act as inhibitor or inducer, affecting the metabolism of concurrent administered medication. Here is an example of the co-administration of rifampin and warfarin. Rifampin is an enzyme inducer and therefore can reduce the concentration of warfarin. It requires increasing the dose of warfarin to achieve the therapeutic effect. Conversely, when ciprofloxacin is co-administered with warfarin, ciprofloxacin is an enzyme inhibitor that can increase the level of warfarin and can increase the risk of bleeding. In such cases, the dose of warfarin should be reduced. Phase 2 metabolism is also known as the conjugation phase, which involves the addition of endogenous substrates to the antibiotics or its phase 1 metabolites. It involves various chemical reactions depending on the antibiotics. For example, chloramphenicol undergoes glucuronidation. Sulfonamides are subjected to sulfation. And penicillin undergoes amino acid conjugation. These processes make the molecules more water-soluble and facilitate their excretion via urine or bile. What is metabolic rate? It is the rate at which the body uses energy. It is influenced by the various factors. Metabolic rates can vary with age. For instance, neonates and the elderly age often have a slower metabolism. Genetic variation can affect enzyme activity, leading to differences in how individuals metabolize antibiotics. Impaired liver or kidney functions can slow metabolism and excretion, potentially leading to toxicity. Other medications can induce or inhibit the metabolic enzyme, altering the metabolism of antibiotics. Therefore, understanding drug metabolism is important in clinical practice. It helps tailor dosages to individual patients, accounting for variations in metabolism rates. This reduces the risk of underdosing or overdosing and improves therapeutic outcomes. It predicts and manages potential side effects and drug interaction. This helps prevent adverse drug reaction and enhance patient safety. We hope you find this presentation helpful. We look forward to seeing you at our next video on drug elimination. Thank you.